Low testosterone symptoms are characterized by low stamina, loss of muscle mass, perhaps irritability, decreased sex drive, and maybe erectile dysfunction as well. You should go see a doctor if you feel that you have low testosterone before you try supplements or before you try some medical therapy that you think will intend to get your testosterone levels up. It generally takes a fasting blood test because sugar can lower testosterone levels, so you want to have an adequate fast. You usually want to draw that blood work between 8 and 10 a.m. in the morning. You want to have those levels repeated on 2 or 3 occasions to validate that you truly do have low testosterone that's consistent and not waxing and waning. From there, you can discuss with your physician whether testosterone placement is necessary or whether there's some other lifestyle changes or natural ways that you could improve your testosterone level without having to begin medication. I know instances where men have had stroke or heart attacks after taking testosterone replacement therapy, and in every one of those cases, they were men who did not need testosterone replacement, but were hoping to have better testosterone levels so that they could perform better sexually. And that's just not very safe, and should discuss with your doctor and know what your levels are before taking testosterone replacement therapy. Cardiovascular disease and diabetes are both two very important disorders that affect erectile function. Both of those disorders can, 1, lead to low testosterone, or 2, arterial insufficiency or blood supply to the sex organ so that it makes erectile ability weakened or non-existent at all. It can be one of the earliest indicators, in fact, of heart disease. Erectile dysfunction can come in a gentleman who's overweight, who's not eating very healthy. Glucose disorders, early diabetes or prediabetes can lower testosterone levels. They can somewhat lead to erectile dysfunction. Obesity lowers testosterone. A gentleman is not very confident when they look in the mirror and see their body habitus, and so they don't want to go into the bedroom and perform. Once erectile dysfunction has occurred once, twice, or 3 times, it becomes more difficult to get that erectile function back because now they're either embarrassed, they think something's really wrong, and they just can't perform the same way that they did previously. In the last decade, direct-to-consumer advertising has flooded the airwaves and the media with advertising about low testosterone syndrome. As a result, 3% of American men are on some form of low testosterone replacement therapy, whether it's indicated or not indicated. When a gentleman experiences erectile dysfunction or what they consider to be low testosterone syndrome, an interview at the doctor, a physical examination, and a stepwise approach to obtaining the right laboratory draw to determine if someone actually has low testosterone is very important. We discourage having trials of testosterone replacement therapy. If you have normal testosterone levels, you're not going to benefit from increasing your levels of testosterone. And I think that the advertising and the media that we see give men the message that more is better. If I raise my testosterone levels above where they fall, then I'll be better sexually, or I'll be better strength-wise, or I'll have more stamina. And that's just not been proven to be the case, especially if you truly do not have low testosterone. There is a number of natural treatments for low testosterone, and low testosterone I'll define in this situation as maybe low normal or right at normal or just below normal. We know that exercise will increase testosterone levels, weight loss by reducing body fat, eating Mediterranean or other plant-based type diets will lower sugar intake, and processed foods also lower sugar so that testosterone levels normally are elevated. Magnesium is found in peanuts, almonds, and cashews. Oysters have large amounts of zinc. Pomegranate, fish, which has a lot of vitamin D. All of these are natural ways of increasing testosterone levels. And for someone who's borderline or just not that symptomatic, or maybe they don't want testosterone replacement therapy, these are some very natural ways that have been proven with good data to increase levels of testosterone.